And so last night, we announced that the government is boosting funding for mental health by $730 million, with a real focus on mental health in our young people and suicide prevention. This is the most significant investment of its kind, and to illustrate how it could change people's lives for the better, I want to share with you some thoughts of someone who's very close to me and works daily with me, who suffers from severe depression and has lived a life of quiet desperation. I never knew until last night of his personal struggles, when he approached me to share his story. He is a father and an active member of his local community, who was first diagnosed with severe depression 20 years ago. It started out as the telltale signs of loss of appetite and insomnia. He would average 3 hours of sleep a night and then try to hold down a full-time job. He felt, in his words, like a zombie. No feeling of happiness or sadness, just personal pain. Being a male in his 20s, he thought that he could beat it all himself. For 3 months, he tried to fight it, and he suffered in silence. Too ashamed to talk to someone about it or go and see a doctor, he finally admitted that he had a weakness, he had a mental illness. He thought about taking his own life and had planned on how to do it. But he worked up the courage eventually to see the doctor. He started medication, which he takes daily ever since, and he manages his illness effectively, and he lives a normal life. But he is just one of the fortunate ones in our community who did get help in time. Every year, over 65,000 Australians make a suicide attempt. Suicide is the leading cause of death for Australians aged between 15 and 44, and the second leading cause of death of those of the age of 45 to 54. 8 Australians today will tragically take their own lives, and 6 of those will be men. Around 3,000 people a year, and a 9% increase between the years 2017 and 18. Younger Australians are more likely to take their own life than to die in a motor vehicle accident. And the suicide rate for Aboriginal and Torres Strait Islander people is approximately twice that of non-Indigenous Australians. So to anybody who is listening today, who is in crisis or is feeling suicidal, please reach out for help. Call Lifeline, call 131114, and someone will be there to help. As a government, we have to do better, and as a nation, we have to do better. And I know this is something that the Prime Minister feels very strongly about and is personally very committed to, having led this particular initiative through the budget process. Funding that we announced last night will provide for 30 new Headspace services, a perinatal mental health program, 4 specialist residential facilities for eating disorders, and more support for Indigenous youth through mentoring and peer support. The high rate of suicide, particularly among our young people, is a national tragedy which we have to take urgent action to address. We will expand the Headspace network, reduce waiting times, and enable more people to get this support that they need. Like a young person from Echuca with depression and anxiety, like a young student in Western Sydney experiencing stress before exams who needs clinical support to remain engaged in their studies, or a young person bullied in Townsville who will not experience unreasonable wait times in order to receive support. These are policies and initiatives that will address a missing gap in our health system. These are policies and initiatives that will save people's lives.